I'm often asked by patients or patients' family members why someone would think about using a naturopath as part of their cancer care. And surprisingly, I don't actually believe that alternative cancer care is the only option for people. I do believe that it's sort of an integrated approach and that chemotherapy and radiation actually are the best treatments for cancer for the most part. They are the ones that have the best evidence. And so my role then is very different with cancer care than it can be for other conditions. One of my roles with cancer care is to actually help people stay on their medication. It seems odd for a naturopath to say that, but many cancer patients have to skip treatments, whether it's androgen deprivation therapy or chemotherapy or radiation, because of blood counts or because of side effects. And so, one way that I can have a role in that is actually helping people stay well while they pursue their conventional care, which is very important in terms of them achieving their best possible outcome. The other way that we can help with cancer care is actually having a direct anti-cancer effect. So often those are the more sort of aggressive treatments that we do in the office, such as high dose IV vitamin C, mistletoe, or even adding some other herbs or antioxidants that are known to have an anti-cancer effect that of course don't interact with your standard medications or other therapies that you're doing. The third thing that we do in the office with respect to cancer care is actually talk about diet and weight, which is often an area that's left out when it comes to conventional cancer care. Some cancers need to be losing weight like it's their job. So breast cancer is often a great example of that, that many new patients at diagnosis are often overweight. And if they can lose weight as part of their care, either before surgery or during their first few rounds of treatment, it actually improves their outcomes by quite a bit and reduces their chance of recurrence. Other cancers often need to gain weight or maintain muscle mass at the very least as part of their care to improve their overall survival. And there's many things we can do from a diet and supplement perspective that actually helps control the inflammation that's related to weight loss in cancer. Because often, even though cancer patients don't often feel like eating, their weight loss is actually happening because of an inflammatory process rather than a lack of calories. So those are basically the three ways that I describe to patients and how we can have an impact in terms of their cancer care. Of course, every patient is different and every patient is pursuing multiple different treatments or even clinical trials for new treatments. But there's always a way that we can support patients depending on what their goals are and depending on what their conventional care is. And so I really encourage patients who are curious about how they can take extra steps in terms of their cancer care or prevent recurrence. Even better than drug therapy, then, in addition to drug therapy, I think it's important to sort of pursue something like naturopathic medicine. So I'd be happy to, give a 15-minute interview to any new prospective patients who are curious about how we would fit in as part of their oncology care.